Using female cells in laboratory animals may not seem like a big deal, but the U.S. National Institutes of Health's announcement that scientists who receive government money must include female cells and animals in their preclinical research is a major development. The NIH is the biggest funder of medical research in this country. Males have traditionally dominated research efforts into drugs. Curtis Meinert at Johns Hopkins University's Bloomberg School of Public Health in Baltimore, Maryland, is an expert in the design of clinical trials. He thinks results from men apply to women too.
In general, things that work, and so it's independent of male or female. So to some degree, I expect it doesn't make much difference.
Not so, according to Phyllis Greenberger, president of the Society for Women's Health Research.
When researchers have looked at sex differences, they sometimes find that something works better in a man versus a woman, or the other way around. So it's not just about women anymore. It's really understanding the mechanism of disease.
Lobbying efforts by women's health advocates led Congress to pass a law in the 1990s requiring federally funded research to include more women in large clinical trials. Before then, it was widely believed that what works for men works for women. Janine Austin Clayton, an ophthalmologist by training, directs the Office of Research on Women's Health at the National Institutes of Health. Dr. Clayton says the participants in NIH-funded research now include an equal number of men and women. She says the two genders respond differently to different drugs. For example, some medication can be harmful to women at doses recommended for men.
We want to understand that so that when I'm treating a patient, any day, my mother, your father, I can design that treatment with that patient in mind, with sex-specific evidence behind it.
Dr. Janine Clayton says illnesses like heart disease and some eye conditions show up differently in women and men, and that's why drugs and dosing need to be tailored for women. Jessica Berman, VOA News, Washington.